Hi, I'm Dr. Rasya Dixit from Dr. Dixit Clinic, Bangalore. I'm a dermatologist in private practice from the last 15 years. A lot of patients come to me with dry and flaky skin on the face, and they often want to know what are the various conditions that could cause this. When I see a patient with dry and flaky skin on the face, the first thing that I look at, even before I start talking to the patient, is understanding what is the skincare that the patient is following. Sometimes over-aggressive use of products, facial products, which may contain retinol, which may contain salicylic acid, glycolic acid, and which may sometimes be purchased over the counter like an anti-aging cream which contains retinol, could be actually causing the flaking of the skin. So it is very important to understand what is the history, how long has the flaking been there? Is it related to any product use? Is it only seasonal? Is it something which is related to particular place? Is the dryness more in that particular place? For example, in a humid place such as Chennai, you might not feel that flakiness so much as in a place like Bangalore, which has a more drier climate. So understanding all this history makes us understand if this dryness or flaking is related only to the skin type or is it related to any product use. Very few conditions are there, especially called psoriasis and sebopsoriasis, which can appear on the face as a flaking on the skin. These conditions are easily distinguished from the other condition where it is only a seasonal dryness, because you can see the patchy face which is continuing throughout the seasons, and there will be a definite margin to all the skin conditions. So in this case, we would need to address the skin condition by giving you a soap-free cleanser, using a hyaluronic acid based moisturizer often, and using some topical creams which may include some low-grade steroids or low-grade tacrolimus based creams which will help the inflammation to subside. Sometimes we do give oral medicines as well for these conditions. However, the first thing I would suggest to you if you have a dry flaky skin condition is to use a soap-free face wash, to use a moisturizer often. Try to use a moisturizer which does not have any fragrance or any preservatives. Try to use something which is very bland emollient frequently, 4 to 5 times a day. Make sure that you are using a broad spectrum physical sunscreen. These physical sunscreens do not irritate the skin, so they are safe to use if you have dry flaky skin as well. And eat food which has a lot of omega-3 fatty acids like your flax seeds, like your almonds, fish, and this should improve your condition over the next 2 to 3 weeks. If it is not settling down, or if the inflammation is more, if the redness is more, if there is associated itching, it is time to go to a dermatologist to get a diagnosis of the condition so that we can treat you better.